All right, let's talk about polycythemia. Polycythemias now we have a relative polycythemia, appropriate absolute, inappropriate absolute, or polycythemia vera. So in the relative polycythemia, we have the plasma volume is decreased, RBC mass is normal, O2 site normal, EPO level is normal. Association is dehydration and burns. So when the dehydration occurred or the burns happened, you have relative to these, you have polycythemia, in which the RBC mass hasn't increased, but it looks like it has been increased because you have lost the plasma volume. You lost plasma volume. Let's say you had 100 RBCs and a plasma volume of, let's say, 500. Now you only have 200 plasma volume and you still have that 100 RBCs. You think, oh, whoa, this is polycythemia. No, this is not polycythemia. You've lost your plasma volume. Coming to the next one, which is appropriate absolute. And then you have the inappropriate absolute. Inappropriate, you have increase in RBC mass. Absolute polycythemia means you would have an increase in RBC mass. But now the problem is that you have an O2 saturation, although you have RBC mass increased, but saturation wise you're decreased and EPO levels are increased. It is seen as appropriate, absolute is seen in lung disease, congenital heart disease, high altitude, and obstructive sleep apnea. So what does absolute really mean in both of them? That there is an absolute increase in RBC mass. So there's an absolute polycythemia. Okay. So that's what we have for, and these are the causes that it causes appropriate. What about inappropriate? Again, same lab, except that saturation is normal. They are the exogenous. If you were to have have given an exogenous EPO, as athlete misuse that, also called blood dope or doping, androgen supplementation. So either you're using EPO as a blood doping or androgen supplementation. That is or inappropriate EPO secretion from malignancy, example, renal cell carcinoma, hepatocellular carcinoma. Okay. So that's pretty much what we have for the inappropriate absolute. Absolute meaning increase in WBC or increase in RBCs. Inappropriate that means you're taking it from outside or getting it from malignancy. Increase in EPO concentrations, which causes polycythemia. Now, lastly, we have polycythemia vera. You have way too much increase in RBC mass. Plasma volume is also increased. No issue in the O2 saturation. EPO levels are decreased. EPO decreases PCV due to negative. EPO decrease in polycythemia vera due to negative feedback, suppressing renal EPO production. Excuse me. EPO comes from the renal cells, right? So when you have so much high in RBC, that negatively inhibits the EPO production. Excuse me. So what is polycythemia? The labs are, if you're a female, if you have a hematocrit which is greater than 48, if you're a male, hematocrit is greater than 52%. So once you have to figure out the hematocrit to call polycythemia. Once you know it is polycythemia, excuse me. Once you know it is polycythemia by the hematocrit, then you can check serum EPO levels. Second thing is to check EPO levels. If the EPO levels are low EPO, then that's polycythemia vera. If the EPO levels are high, then that's inappropriate absolute polycythemia. And remember, in polycythemia, you have all three cell line increase, but majorly you increase RBC. Now, the third thing you want to do is you want to rule out if that polycythemia is due to hypoxia. So basically, you check EPO, it's not high, it's not low, it's normal. Then you look for hypoxia versus other causes of polycythemia, and those causes are right here. You check for the guy has obstructive sleep apnea, lung disease, congenital heart disease, high altitude. Okay, so this is the way we go for it. Or the burns or anything like that. For example, you have a chronic hypoxia from high altitude, smoking, COPD, interstitial lung disease, obesity, which leads to this thing, is sleep apnea, EPO secretion from the tumor. So that's why we, in all these cases, to check hypoxia, we are looking at O2 saturation. Okay, so that's the way to go for this thing. So this was all the causes, right? That's all for the polycythemia. But again, this is really good if you can just put in your head polycythemia. Check hematocrit. I'm just going over it. Check hematocrit. If it is high, if the hematocrit is high, and it's absolute high, meaning you have absolute erythrocytosis, meaning increase in RBC levels, then you follow EPO, then you high, low, look at whatever it is, and then go to hypoxia. But if you have a high hematocrit, but you check and it says the RBC mass is normal, but you have a high hematocrit, which means you have polycythemia, but you have normal RBC when you check, it's called relative polycythemia. That you have normal mass of RBCs, it's just that you're losing the volume so much due to dehydration, burns. That's all for polycythemia.